Hello and welcome to the Convergent Science Network's Women in Biomedicine panel. I'm Katrina Newman-Robertson. I'm a Science Communications Officer for the Convergent Science Network. Before we all begin, I would like to acknowledge the traditional owners of the lands on which I'm streaming to you from. I acknowledge that we all might be on different lands, which is amazing. It's great to have people coming in from all sorts of places. But I myself am on the lands of the Bunurong people of the Kulin Nation, and I pay my respects to their elders, past and present. I think we're here to talk about science, and I think it's important to remember that they are the first scientists of this land, and they've been learning all about the land, the sky, and the sea over tens of thousands of years and sharing that knowledge and passing on that knowledge. And that's really what science is all about. And we're here today because we like science, specifically biomedicine. And what's really important when we think about science is the fact that the talents of women in science, technology, engineering, and mathematics and medicine, STEM, are vital to the future of Australia and, let's be honest, the world. Yet it's no secret that women are sometimes quite poorly represented in the STEM fields and the workforce. And this Convergent Science Network series, Women in Biomed, explores the careers of amazing women in biomedicine. We celebrate their successes, talk a little bit about their work and their research and their experiences throughout their careers. So we'll kick off the conversation, and I will also call on you to ask questions. So start thinking about what questions you might like to ask our speakers today. And if you want to continue the conversation online as well and the discussion, share your thoughts, you can please use the hashtag Women in Biomed and tag us at Conversi. Now, our speakers today, it is my delight to welcome Professor Kate Hoy and Dr. Clare Fedele, two medical researchers who have a focus on translating science to improve people's health. Now, just a brief bio about both of them. Professor Kate Hoy is a clinician researcher dedicated to using neuroscience to develop novel treatments for cognitive disorders. She currently leads multiple world-first clinical trials aimed at improving cognition for Alzheimer's disease, as well as preventing dementia in people with mild cognitive impairment as well. So welcome, Kate. And we also have Dr. Clare Fedele, who's a returning person or speaker to the Convergent Science Network. We're delighted to have you again. Clare is currently a senior research scientist in translational research at CSL. Until last year, she was a cancer researcher, biochemist, and science communication specialist at the Peter MacCallum Cancer Centre. And now at CSL, she endeavours to understand how human disease develops and progresses using multidisciplinary approaches. Now I'm going to hand over to them. Welcome. Thank you for joining us today, Clare and Kate. I might throw the first question to Clare. Could you briefly share a little bit about your current work as a senior research scientist at CSL?
Yeah, absolutely. And thanks for having me. This is a real pleasure to be part of this conversation. So happy to kick things off, talk a little bit about the research that I'm doing at the moment. As you said, Katrina, the path has been a little bit winding, but where I find myself at the moment is with CSL. And for those of you on the call who might not have heard of CSL before, it's a Melbourne-based but global biotechnology company. So CSL focuses on the development and also all the way through to the delivery of medicines to help people with serious and life-threatening conditions. So CSL has a very large internal research workforce that are forging discoveries, and we focus across a number of broad, what we call therapeutic areas of focus. So we're looking across immunology, hematology, nephrology and transplant, respiratory conditions, cardiovascular and metabolic, and influenza, which CSL is obviously very well known for its influenza vaccines. So particularly my role within the translational research team is to provide support to projects really across all of the therapeutic areas, but in particular, I'm focused on the cardiovascular and metabolic program. And we support the projects all the way sort of through the research and development pipeline, actually from project initiation, the very start of when projects come in or we identify a new target, all the way through to clinical development. So in that way, it's very interesting and exciting because in my role, I'm kind of exposed to all of the steps that it takes to see a drug go from being a research molecule all the way to actually going into people. So we can address lots of different types of questions through my role, but so it's very broad. But I guess there are kind of some main themes that we focus on. So some of the questions that we use are around target validation, and that's where we have a predetermined target in mind, and we want to know whether it's present or whether it's changed in a particular disease or diseases that we're particularly interested in. Another type of question we could do is target discovery, where we're interested in developing therapeutics in a particular disease, and we're looking for new targets that we can potentially develop new molecules towards. We can look at things like mechanism of action of our molecules of interest, so understanding what our candidate molecules are doing within cells and tissues, how that candidate molecule is acting to have its effect. And another area which I think is really, really interesting is biomarker discovery. So we can try to find markers that help us identify which patients are more likely to respond to a certain therapy. So that's either patients that have different types of diseases, or even within one disease cohort, which patients are more likely to respond to a certain therapy. So it's around the idea of personalised therapy and biomarker discovery. So what's interesting about my role at the moment is it's largely dry lab work. So this is using computational approaches to interrogate big data sets, trying to derive, I guess, biologically and clinically relevant insights that can help answer the questions that I kind of outlined above. But also, it's interesting because it's a big change for me, because I kind of cut my teeth in research as a wet lab scientist. So the role is giving me a really wonderful opportunity to learn and expand on my skills. So I'm now coding in R and analyzing rich omics data sets, so transcriptomics and proteomics that we generate in-house, and also interrogation of publicly available data. So it's a really different thing for me to be doing, and I'm really enjoying it. And it just goes to show that it's never too late to learn some new skills.
Love it. Yeah, that's absolutely right. Some of the things that you're talking about, I'm like, oh, if only I knew how to do those. But I guess, as you say, it's never too late to learn. I want to unpack a lot of that later, but we might just throw to Kate as well, so that you can have your voice in the mix. Kate, you've built an internationally unique program of clinical research that sort of focuses around this idea of non-invasive brain stimulation for the treatment of cognitive impairment, which I sort of mentioned as part of your bio. But what is the idea behind brain stimulation as a treatment?
So firstly, thank you so much for inviting me to speak today. It's a great opportunity, and I'm really excited to do it. So, look, brain stimulation are a collection of techniques that are able to change brain activity, and the techniques we use are what we call non-invasive. So they don't require surgery. They don't involve any medication. They're all externally held to the head. And what we can do is by applying either magnetic or electrical stimulation, we're actually able to change local brain activity, but also connectivity throughout the brain, so that we can really enhance and repair the connections in the brain. And what we know in cognitive disorders, so disorders like Alzheimer's disease, but also other areas such as cognitive impairment from traumatic brain injury. Psychiatric conditions also have cognitive symptoms as well. So depression and schizophrenia can have quite significant cognitive impairment. And we know that in all of those cases, there is dysfunctional connectivity throughout the brain. And they occur for different reasons. So in traumatic brain injury, the reason that you get dysfunctional connectivity is more related to the physical knock to the head, and the neurometabolic cascade that occurs from that can lead to impairment in neural functioning or brain functioning and impaired connectivity. Whereas in something like Alzheimer's disease, we get the buildup of amyloid and tau proteins in the brain, which damage the function of brain cells, and that can go on to induce problems in connectivity throughout the brain. And look, why that's important is we understand the way cognition is represented in the brain really differently than what we used to. So it's not specific brain areas which control specific types of our thinking. Successful cognition, so successful memory and decision making, executive function, actually requires strong and healthy connectivity throughout the entire brain. So when we look at those two things, we've got a technique which can enhance connectivity, strengthen connectivity throughout the brain. We have a number of disorders where impairments in connectivity is a really significant marker that is associated with the cognitive symptoms. And so what we're trying to do is put those together and see if we can develop effective treatments for these disorders.
Yeah, amazing. It's really interesting to hear the thought process behind it. So given that you have these sorts of ideas and this understanding of how it all works, how do you go from an idea of, we need to improve sort of the connectivity and we need to maybe stimulate these areas or this certain thing, to actually translating something into the clinic? Because a lot of what you do is about driving that clinical practice and that change.
Yeah, that's a really good question. So my program is developed on a structure that's called experimental therapeutics, and what that is essentially the point of our clinical trials and the point of our early research is actually to identify relevant therapeutic targets. So we don't start out with, I'm going to apply brain stimulation to this part of the head and run a huge clinical trial and see what happens. What we do is initial work. So when I started doing this work about 15 years ago, we actually did a series of studies in healthy controls that allowed us to understand more about how these different types of brain stimulation actually affect brain activity and how that is related to cognition. There hadn't been a lot of that work done. And so we spent sort of 5 to 6 years and a lot of wonderful PhD students doing that work, getting an understanding of how these different types of brain stimulation techniques and different parameters, different doses, how does that affect different types of brain activity? And then we would look at understanding the disorders that we were interested in. And so we would do sort of comprehensive investigations of disorders that we wanted to develop targets for and to investigate the brain activity that would underlie those the symptoms that we were particularly interested in. So we would use things like electroencephalogram or EEG. We would use neuroimaging, so PET, fMRI, MRI. So we'd use all these techniques to try and identify therapeutic targets that were relevant to brain stimulation. So it was only really, if we found something really, really deep in the brain that was of interest, the brain stimulation techniques we use won't reach there. So we had some parameters around what we were looking for. And then only then when we found, a match between the therapeutic target in the disorder that we were interested in and a brain stimulation technique that we thought there was, a good hypothesis that can affect it, then we would run a proof of concept clinical trial to see whether, one, we could get target engagement. Can we actually change that brain activity in that disorder with that brain stimulation? And two, is there any association of that change with the symptoms? Is that target actually as relevant to the symptoms as what we originally hypothesized? Where that is a positive proof of concept, we would then move on to a large-scale clinical trial, to like a phase 2A or phase 2B trial, to see if we can actually develop an approach that had a real functional impact on people's lives, so that we would look at more broadly the effects of a longer course of treatment and what actually improvements it had functionally day to day. And so they're the steps you would take before you would look to translate something to the clinic.
Thanks for guiding us through all of that. Claire, you're also looking at taking ideas and putting them through the pipeline to get it to translation, which you already sort of mentioned. Is your process at CSL, any similar or a little bit different? How do you go from idea to something in the clinic?
It's a really good question, and actually, as I was listening to Kate's response to the last question, I was sort of thinking in my head, "Wow, that's exactly what we do." I think there are logical steps to this, and there are kind of doing these things in an academic setting with a clear translational pathway or pipeline, and there are ways to do it in industry or in a pharmaceutical setting, which have their own internal sort of pipelines and processes, but actually some of the steps are extremely similar. So one of the things that I think is really common in what Kate was just describing is this idea of deep understanding of disease. So really being led by how much can we understand about what is causing, so the pathobiology of that disease, what is actually driving the disease, understanding that, and then helping that to guide the kind of rationale of how do we go in and design therapeutics that are likely or more likely to be able to specifically go in and target that, that fine point or that fine tuning of what's going wrong in disease. And so we spend a lot of time looking at the disease. So we run, sort of bringing it back, I guess, to some of the things that I do in my role is we run what are called kind of non-interventional research studies or observational studies, where we're just interested. We're not sort of concerned at this point about, putting a molecule into a person and seeing what happens. This is about getting samples from patients and trying to really get a deep understanding of disease. And that forms part of a lot of what we do. And we can use that information to then kind of go back and start thinking about some of the questions that I highlighted earlier around, can we find brand new targets? Are there actually targets going wrong in that disease that we already have a therapeutic for, that we could possibly repurpose, something that we've already developed that's already been tested in humans, and we could potentially then fast track getting that to people who really need it. So we look at, we kind of approach it from different angles. We use it a lot for things like biomarker discovery to try to understand if we can stratify patients into different groups based on their disease pathobiology. So a lot of those things underlie, that's where the sort of the translational component of what we do comes in, because we take those human samples, we take them back into the lab, we test them, we look at them, we interrogate them, and then we come up with rationales of how to then apply a therapeutic, which we would then go back basically into and try to push that into the next phases of clinical development. So I think, these rationales of how you go about, it's sort of an academic thing, it's like, well, how do you know how to treat something if you don't understand it? That rationale of, well, let's understand it. Let's do that basic stuff first, or fundamental stuff. I would never call it basic because it's far from, but we got to do the fundamental stuff if we're going to really get therapies and treatments at the end of the day that are effective, that have low adverse events, that are, really delivering the things that patients need or that people need to improve their health and well-being. So, I think that it's a very similar process.
Yeah. And patients, that's like, and people, that is central to your work, right? For both of you. And so I can imagine that science communication and talking to people has been a large part of your work for both of you, not only to share your research to other people in your field and also share your own research, but also supporting other people communicating their science and conveying their important messages. So why do you think that communicating science is so important? Maybe we'll start with you, Claire, because I know that was in your job title, Science Communications Officer, and then we'll go to Kate.
I mean, it's a big question, isn't it? I think we could probably spend the full hour maybe talking about that, but I might give some thoughts and then pass it on, because I'd like to hear Kate's thoughts on this as well. For me, there's no downside to good communication. Really, it is absolutely fundamental just for life, but also, for being a scientist. It's for every outcome as a scientist in terms of of your successes is really underpinned by your ability to be able to communicate your science to different different audiences. So that may be to funding bodies to support your research. It may be to journal editors to get your research published. It might be to the people who you're trying to help to try to get their feedback, to really understand where the clinical need is for those people who are affected by the disease or the disorder that it is that that you're trying to help. So for me, it's not why communicate, but it absolutely is why not. And why would you not really want to be able to do all of these things to the highest level that you're capable of? And everybody's capable of different levels, and that's fine. Not everybody is going to be a hotshot TV science presenter. But the development within your means and your abilities to be able to communicate at the absolute highest for you, I think should be number one priority. Maybe number one priority, maybe closely number two, but it should be absolutely at the top of the priority list for everybody that is involved in science and research. So not why, but why not?
And I just before you jump in, Kate, I just want to point out that you've said, Claire, go to the highest of your ability. And you've already said before, it's never too late to learn, right? So that high might just get higher and higher the more you do it, right?
Absolutely, absolutely. The more for things like communication, it is, there's often people who will say, "Oh, I just can't talk in front of a crowd," or I would never be able to do that. And I think we all feel like that at the start, and it's about maybe putting yourself out of your comfort zone a little bit and doing things and getting involved and stepping outside of the whatever research setting you're in, if that's a lab or the field or whatever it is, and getting out and doing some things that are a little bit different. And the more you do, you absolutely will improve. So yeah, it's just about getting out there and broadening your experiences.
Yeah, thanks, Claire. Kate, do you want to jump in?
Yeah, so I think I agree with everything that Claire just said, in particular that you get better the more you do it. So it is definitely something that as you do more and more, you will get more comfortable with it, and your skills will improve. But just more broadly about why sort of science communication is important, I don't think there's been a more important time to be good at communicating science to the general public, to be good at communicating evidence base and the scientific process, and how things work in science and how we come to conclusions. I think that it's critical for the general public to have a good understanding of science and the way science works. I think that's really critical at the moment. I think the other thing as well is we have, I love science communication. I love talking to different groups of people. I've had quite a few public talks over the last few weeks, and I enjoy every one of them. I think there's a responsibility as well to sort of get out there and talk about the research we're doing to people who are interested, and to answer any questions they have. One of the other sides of it is I see science communication as really two ways. So when I trained as a clinical neuropsychologist, and towards the end of my training and early on in my clinical career, my drive for research and what I do actually came from my patients, from conversations with my patients, from seeing the limitations of treatments that were available, hearing about what they wanted and what they needed. And then that allowed me to, develop a research idea, an area that I wanted to pursue. And so, you get as much from science communication as what you give when you engage in it, I've found.
Yeah. And how do you give then? What sort of ways do you use, Kate, to get your messages out there and to communicate? You did mention public lectures. Both of you are here, which is wonderful. Kate?
Any way that people will listen to me, essentially. So social media certainly has a place. More mainstream media has a place if you have a particularly interesting finding that or a particularly interesting research project that the media want to pick up on. It's always great to do that. Engaging in public lectures, engaging in one-on-one conversations with people. Any way to do it. I'm open to doing that.
Thanks. Claire, I know you've got a lot of experience with it.
No, it's interesting because I guess I probably did. I probably used to do a lot more actually in an academic setting. When you're in industry, there's sometimes some limitations in what you can and can't talk about. So, it's sort of the message starts to change a little bit, but it's still important, I think, to engage. Kate's point is really well put. That the responsibility of scientists to engage with the public and to help the public understand what research is all about and the limitations as well as the wins of the scientific approach. I think we get to hear a lot about the successes, and very rarely do we really understand how much kind of goes into one of those successes and why it takes so long. So there's a responsibility for the scientific community to communicate that to the public, and also when you're funded by public money, I think there is a responsibility for you to keep the public informed about what it is that you're spending their money on, and I think that's another important part to this as well. It's there's a responsibility that when you're using people's hard-earned taxpayer money that we give back a little bit, and it's not a black box. It's not it's something for us, and you wouldn't possibly understand it, so don't worry about it. They're the ones funding it in a lot of the cases. So I think that there's a responsibility for us to tell people what we're doing.
Yeah, do you think it goes both ways in that there's this responsibility to tell the public about what goes on in research because they're funding it, but also do we attract more funding and do we get more people behind us the more we communicate?
Yeah, absolutely. I mean, the more that people will, understand what you're doing, interested in what you're doing, then, the more chance you have to get champions out in the community, which are really, really important. So I think absolutely getting people on board is really, a great thing for us to do. And just to touch on something Claire said then, absolutely the way that science works and how it doesn't work sometimes and what that means. And that science is it's an ongoing process of adapting and evolving knowledge, and you don't stop learning. And so when things change, it doesn't mean that you were deliberately wrong or something like that happened. It just means that we've evolved our understanding and we know more now. And I think that that's a really critical part of science that perhaps is not as well known more generally.
Yeah, it was a really lovely point, Claire. The idea that, if things fail, maybe it's not a fail. Like you're learning about why something doesn't work. Claire, you're about to jump in. Did you want to add to what Kate said?
I think, I mean, the question of how we best communicate to improve support and funding for research is I think a quite a complicated point actually. And again, I think it's probably the topic of an entire session in itself. I think that as scientists and researchers, as a community, become better at talking to diverse audiences about their research and about the impact of the potential impact of their research, that we will be better equipped to be able to engage with decision makers. And I think that's, so again, it's sort of about strategic communication in that point. Who are the people really that we need to be able to connect with? What are their priorities? What are they being driven by? And how do we strategically communicate to them to put us in the best position to be able to get them on our side and to support us? And I think that's sort of a collective, difficult, big thing to think about. But, I think when we're talking about communication, it has to be acknowledged that there are there's kind of approaches and purposes and different audiences, and there's not a one stop in terms of the best way to communicate. I think we should tailor our communications very much to people who are in sort of decision-making roles there, and to have them understand also this concept that research is a long game, and and it may not get them votes in the next election, but it's an investment in the future of this country, as well as the health and well-being of people all around the world, and that's something that we need to invest in.
Yeah, totally. And as you point out, we could keep talking about this, but I want to backtrack a little bit and think about your careers as they've sort of happened over the course of several years. Claire, you spent over a decade in cancer biology research at Peter Mac, the Peter MacCallum Cancer Centre, and then you moved to CSL last year. So is there a particular reason that you're like, it's time to move?
It's always a good question, and it always stumps me, because I think it's a complicated answer, because I just have a deep love for research, and in particular cancer research, and the move away from academic research was not really anything to do with the passion that I had for that. In fact, I think it's really only grown over the years. The reason for the big career move was that I think for a while I was feeling unfulfilled, or there was something not being fulfilled for me within that role, and I'd had to do a lot of kind of reflecting and thinking about what it is that was really important to me, and what I felt like I was trying to achieve out of my career. And I think the thing that was challenging for me in the academic setting was that while I absolutely loved the kind of the nuts and bolts and the nitty-gritty of the lab work, where my values really lie is in seeing the work that I'm doing being translated to real world changes for people. And I felt that while I was doing I think relevant work and important work in the lab, it was just a bridge too far. There was too much of a gap for me between what I was doing in the lab and the potential to translate that into making a difference for people. And it took me quite a long time to kind of realize that, because really at the core of it is a love for research and a want to do good. And I've gone through this process of trying to understand what that means for me and how I actually achieve that. Because I think the important thing for people to know when they're embarking on a career in science, or where they're in a career in science, is that there's lots of different ways that we can all contribute, and it doesn't have to all look the same, and we don't all have to follow the same career path. And going on a slightly different career path doesn't mean that you're no longer kind of contributing to that doing good, or that that want to grow knowledge. It's just that we can do it in different ways, and it's important for us to find our individual path in what suits us as and what ticks our values boxes. And so I kind of went through a path of trying to understand where I could bring the most value, and how I could really get to that point of making a difference. And so I went through this path of having that communication aspect where, if I could connect with people in that sense, is that the way that I'm going to be able to best make my contribution? And I think doing that has been absolutely hugely valuable, and I loved it. It still, the draw of the research was too strong. I think I needed that aspect as well. And in going through this process, being able to then make an active decision to say, I went away, I did something else, I loved it, and now I'm being drawn back to this, is very empowering. And it means that, now I'm quite clear about what it is that I'm wanting to do, understanding the environment that's best suited for me in order to do that. So I guess that's the kind of the path that's led me here.
Yeah, thank you for sharing that. And it's, it's your path. And I think that's so important. And Kate, you've really carved your own path as well. You've built this unique clinical research kind of niche for yourself over, a decade, 15 years. What is it like driving research that no one's really done before?
It's exciting and very challenging. So there's always that. This is a bit of an out there idea. Well, certainly when I started, it was a real out there idea that we could create treatments that would actually improve cognition, and potentially reverse some of the damage that had been done, for illnesses such as Alzheimer's, potentially, for traumatic brain injury, for schizophrenia. These were seen as really intractable symptoms, their cognition symptoms. And so I didn't know if it was going to work because that's science. I had an idea, and I wanted to pursue it. And I had incredible support from my mentor and my wider team in doing that. And I think the other thing that was really important is that I never assumed it was going to work, and I never got attached to my hypotheses, which I think can be a really dangerous thing to do. The data was the data, and we pursued the things that showed promise, and we didn't pursue the things that, we couldn't actually come up with a viable hypothesis or, good data to support the idea. And so over time, things, that means that's important. That allows you to get a bit more narrow in what you're doing instead of trying to do everything, which is very challenging. But yeah, it is exciting to try and do something that, at the time, at least when I started it, there hadn't been a lot of focus on using the techniques in this way.
Yeah, thank you. So you've started to move into something that I want to talk about, which are the challenges, because you're both doing such excellent work, but there are challenges that come up in life and in work. Just a reminder to everyone tuning in, if you have any questions for Clare and Kate, please do type them and we'll get to them. But Kate, just because we were already talking and you're on a roll now, you are juggling so many different things. So for everyone tuning in, just as a bit of context, if you look up Clare and Kate online, like, they have long bios and many accolades and positions. But Kate, you're juggling being a clinical neuropsychologist, you're a senior research scientist, I believe you're setting up a private practice as well, and you head the cognitive disorders treatment program at the Bionics Institute, to just name a few of the things that you're doing. How do you juggle it all?
With variable success at different times. I think prioritizing things is really important. So there'll be times when I need to focus on, the clinical trial aspects of what we're doing, and that might take up the majority of my time. And then looking at other aspects of what I want to do, like starting up a private practice, that takes a back seat for a little while. And so I think for me personally, and I think, what Clare said was really important, you need to define, what success means to you, and not let other people define success, or don't be drawn in by what, academic success is supposed to be. For me, success is doing a job where I'm able to help people, where I have patient contact, I'm able to see patients, and also to have a life outside of work where I see my family, my friends, and, I enjoy myself and I don't work all the time. I used to be very bad at that. And the last so I've been at Bionics for about a year and a half. I left Monash University after, technically about 20-something years, because I started there as an undergraduate student and went all the way through there. But I left academia, and it was interesting, Clare. I had, I think, almost the exact same thought process at the time, was that academia just wasn't fulfilling me anymore. And the frustrations were outweighing the delights. And I think when that starts to happen, you really need to take a step back. And the biggest thing for me was I wanted to prioritise translation, getting treatments out to patients where they're needed. And, one of the reasons I came to Bionics was because that is there. So Bionics is an independent medical research institute. and they're very focused on commercialisation and translation of effective treatments. It's getting things out to patients is their drive. And for me, that was something that aligned really well with my values and what I wanted to get out of. I mean, it was the reason I got into the clinical research in the first place and out of and away from clinical work, was because I wanted to get treatments to patients. And it's just not well facilitated by academia, unfortunately, at least not at the moment. And maybe that will improve, maybe it won't. But after 15 years, I needed a change and I needed a sort of a reset, I think. So I've been able to do that, and I think the whole juggling thing is you've got to include your life in that juggle. It can't, you need to have that, I say balance, and I know that sometimes that's a bit of a contentious word, but I think it is important to be able to separate out your work from the rest of your life, and as I said, to define success for yourself. What success really means to you. What do you, when you look back on your life, will you wish that you had one more paper? Will you wish that you had gotten in that extra grant, or will you wish that you'd spent more time with your family and friends and made some sort of other impact? And yeah, that was a bit of a reckoning for me about a year and a half ago, and made the decision to move on. Sorry, I think that was a bit of a detour from the original question.
No, but it was all important. And you started talking about family and having that life outside of work, which is so important. You're finding that, if we don't want to use the word balance, I don't know what word to use, but yeah, just finding that.
Yeah.
Claire, you also do quite a bit of juggling and speaking of family, you take care of 2 children while also doing your research. And I know you used to also regularly go out to schools, chat to school students, and also you chatted to the media. How did you manage all of that?
I mean, it's a good question. I just want to thank Kate for her insights there, because I think it's still hugely valuable for me to hear the stories of other people who have gone through these sorts of challenges, and I think that it's really important that people listening as well, they hear that there are choices, and it's never too late to do anything, and success looks different to everybody. So I think so that's wonderful to have that part of the conversation. So yeah, I mean the juggling. Look, there's always going on. I think I don't love the juggling analogy, because the juggling analogy implies that you have lots of balls in the air at the same time, and I think the reality is you can't have all of those balls in the air at the same time, because they will all drop. And so I sort of think about it less as a juggling act and more of as just a giant Trello board where you have buckets of things in your life, and sometimes the buckets move into, yes, this is a priority right now, and sometimes things move out of the to-do bucket, so out of the right now bucket into the to-do list, and that's for another day. And I think that's just, it's understanding that priorities come and go, and move up when they move down, and that's just life. We can't do it all, and we shouldn't try. And it's just about identifying what it is right now that is the absolute, number 1, 2, 3, focusing on those, making sure that those get done really to the best that you can do them. And then once they're done, allowing some other things, once you have a little bit more time, allowing some other things to come in. Yes, I feel like I've got an opening here to do this, I can bring that over. Or no, at the moment, my board is full, I'm going to push that into another thing, and I can, and I will get to it later if it is a priority to me. And sometimes the reality is we can't do everything, and if there are things that we can't fit in, we just have to say no. So, I think over probably the last 5 or 6 years, the priorities in my life have kind of changed dramatically, and in order to kind of to be there for my family and take on caring roles, as well as being fully engaged in full-time research, you just have to be pretty brutal with those cards and move them in and out just really as you need them, and that may be intense for a while. It's usually, the intensity comes and goes, and if it's intense for a while, it usually kind of wanes as well. But, just supporting Kate in saying that, we need to be well-rounded people. Nothing, it never ended well for martyrs. I think we can say historically martyrs never really ended up doing very well for themselves. So, I think we need to acknowledge that we have this drive to help others. At the same time, we really should be taking care of ourselves and helping ourselves. And when we do that, we're actually in a better position to be able to help others. So it's hugely important. And now I make sure absolutely to take time amongst all these things to try to get some time for myself, and to spend time with the people that are really the most important.
Thank you both so much for sharing that. I think, people who are perhaps earlier in their careers, whether it's an early career researcher or, students as well, we often sort of see or have all the weight of the world on our shoulders as we're sort of like, getting through studies, getting through the next thing. So it was really lovely to hear from the both of you about, that sort of light at the end of the tunnel as you work out what it is that you're doing and how to sort of manage all what's in front of you, what's on your table right now or your board right now.
And
Claire,
sorry. Just on that, because I think you raise a really important point, and I'll be very quick, I promise. But just on that, what success meant to me, I think it's important, is it changed over my career. And so when I was early career researcher, my values did align with academia and what I was doing, and I loved it. And I loved it up until the point when I didn't. And that's okay. I think that the thing that's important to do is to ask yourself regularly, is this right for me? Does this fulfill me? Is this aligned with my values? And the answer might be yes, and that's fantastic, and continue on. At least you're checking in with yourself. And when the answer is no, then you need to sort of sit down and think about it. But for some people, the answer will be yes, academia is where I want to be, and that's wonderful. It's just important to know that academia is one place to do this type of work, and there are many other places that you can, and it's just about finding the one that fits with you. And if you do want to prioritise life outside of work, that does not mean that you don't have passion and drive for your research and what you're doing, and never let anyone tell you that that's the case, because you can have both.
Very important message. Claire, before we sort of went away from the point, you spoke about, support yourself and help yourself, and then you can help others. You have done a lot of work to help others. You were the founder and the chair of the Peter Mac Postdoctoral Society, which involved, I believe, establishing networking, support, and mentoring programs for early to mid-career researchers. Why do you think that it is so important to have groups like these and societies like these in academia or in research?
I think they're absolutely fundamental. I really do. I think that that it can be a lonely place sometimes doing academic research. And I think a lot of the conversations that happen within academia are very focused on the science, very focused on the results and the successes, the outputs that you have. And unless you really have a dedicated avenue for you to engage with your colleagues who are going through the same sort of career challenges that you might be going through, or even to just connect with people on a one-to-one level on something that's not, purely about your research, I think is absolutely fundamental. Just to being a well-rounded person, it's not possible for the long haul to just be completely focused on what's happening within your research. You will burn out, and it's not healthy. You need to, in my opinion, that there needs to be avenues made available to you, that there is support for you outside of that pure kind of scientific discussion, if that's something that you need. So, I think a lot of the things that I've done around this support has been driven a little bit by what I felt I needed at the time. And I figured if I needed them, that potentially there were some other people that may have needed them as well. So, I think going away from this idea that in order to be successful in science, you have to only ever do and think and talk about science. I think we need to move away from that idea and encourage people to be different and to be diverse and to engage in diverse activities and go out and get different perspectives and have conversations with your colleagues that are fun and that help you to engage. Because, at the end of the day, if you want to collaborate on a scientific endeavor, you're more likely to do it with somebody that you get along with and that you can have a great conversation with. And the only real way to network in that way is to have these kind of societies and groups available for you to engage with outside of your pure lab-based meetings or your science-based meetings.
And speaking of societies, Kate, you were the president of the Australasian Brain Stimulation Society, and I also know that you've founded Women in Brainstim, that initiative to support female scientists in your field of brain stimulation. Do you want to talk a little bit about that initiative and perhaps, how you feel like you're supporting people in your field?
Yeah, absolutely. So really importantly, as Claire said, the Women in Brainstim initiative came from a really egregious lack of diversity in the brain stimulation field, and in particular in the speaker representations at the international conferences. So our biggest journal put on its first international conference in 2015, and out of around 39 invited speakers, there were 2 women. One of them was me, and that was because my male boss got too many speaker invitations for the conference and he gave one to me. But really, it was a really stark experience to sit in the audience and just see that lack of diversity. And I had a number of people come up to me and sort of comment on it. And so I let the organisers know, and I said it would be good if for the next conference, we could focus on that and get a bit more diversity. And so the conference organisers were the editors of the journal, and they assured me it was an oversight and absolutely, and it would be rectified. So fast forward 2 years to the second International Brain Stimulation Conference, which was held in Barcelona. 10 invited speakers. Not only were they all male, they all had presented at the previous conference. And that's the last time I've ever raised the issue of diversity and inclusion quietly. It doesn't work. So what I did was I wrote a letter to the editors of that journal, calling it out, essentially saying that, this is not representative of the field. And, there are so many wonderful researchers from diverse life experiences, from diverse backgrounds, that aren't getting the opportunity to speak. And you're hearing the same things over and over again. There's not a lot of innovation when it's always the same group of people who are speaking. And so in addition to the letter, I created a website that people could join, and, you could put all your information up about the research you did and if you were willing to be a speaker, so that if they ever wanted to try and have a more diverse conference, and they could go to the website and search and find people that would suit their topic of the conference. And so there's over 300 people on that website now from more than 30 countries. And look, it hasn't solved all the problems, of course, but, there are improvements. There are conferences now, international conferences, that use diversity and their balanced speaker profiles as a real selling point of the conference. And I think one of the really critical things is, and this is so clear in medical research, is that a lack of diversity is dangerous. And in a lot of instances, it can be an issue of life and death. We see medications put off the market because of, unwanted and serious health effects in women that were not picked up during the research process because of, a lack of women and female cell lines used in the development of these treatments. And you can trace that back to a lack of diversity in the research groups. Now, there's been a lot of efforts to change that and to make sure that doesn't happen anymore, and Claire could talk to that more informatively than I could. But when you look at something like brain stimulation as an example, brain stimulation, or TMS, transcranial magnetic stimulation in particular, is a very well-supported treatment for depression. And the majority of that work has been driven by a group of researchers, very dedicated, very good researchers. But it was only, maybe 5 or 6 years ago that some of the younger women researchers in the field started to look at the effect of hormonal fluctuations on the effect of brain stimulation, and we've found that there actually are differences, that cortical excitability changes depending on hormonal fluctuation. And that can have a direct impact upon the effectiveness of a treatment. And so we're starting to look at that now and understand, is there a better way to provide treatment to women? Is this something we need to account for? But that wasn't even looked at 5 years ago. So these, a lack of diversity has flow-on impacts and serious impacts in development of treatment.
Yeah, thank you both so much for seeing a need for yourself and yourselves and the people around you, and then just going for it, championing, advocating, and getting things done. I think that's wonderful and so inspirational to see you both doing that. We have a question from Maya asking about communication. So we're just jumping back to communications, and maybe just try and keep your answers brief, because maybe we've already touched on some of this, but do you think that there will be a time when it's compulsory and part of the funding process that you do have to communicate your results to a lay audience? And do you think if that does become compulsory, will there be a positive impact from that? Maybe we'll start with Claire and then go to Kate.
I think it's a great question, and I think that that it would be a wonderful initiative. I don't see any negative outcome of doing that. It could only be positive. So, do I think there's a time where that will be compulsory? I would hope so. I think that it would be a great initiative. There might be some attitudes that need changing around the importance of communicating science before that becomes a reality. But I think that really it would only have a positive income or outcome, potentially both income and outcome.
Thank you, Kate.
Oh, look, I just agree exactly with what Claire said. I think that I don't see it happening in the near future. I think there would need to be processes and structures put in place to support people who might not be comfortable communicating, to ensure they had enough support and practice and, enough places to do it, to make sure that there was equal accessibility for everybody to fulfill that. I would only see it having a positive outcome the more that we communicate science, and not only for the public but also for the researcher, because you will, as you progress in your career, need to speak about your research to lots of different people who have lots of different backgrounds and levels of understanding of science. And so being able to describe your research in many different ways is only a benefit to you.
Wonderful. We've just talked about some challenges, but I want to end on a positive note. So in 60 seconds or less, can you tell me or us, what is your favorite thing about your job and your role or being in biomedicine? Do either of you have an answer to go straight away? I know I'm just throwing you on the spot here.
Okay. I'll have a go. So my favourite thing about being in biomedicine is the discovery elements of things. So, and whether that be discovery of my own research, of outcomes for clinical trials, finding things you didn't expect, or the discovery of my PhD students. There's nothing a supervisor likes more than an email from a PhD student saying, "Oh my God, can I show you something really cool in my data?" I think any supervisor would drop everything for that meeting or for that chat. So that element of it has always been really, really exciting to me, and the bit I love the most.
Thanks, Claire.
I'm nodding away because I'm exactly the same. It has to be. I mean, for me, that's kind of everything. It's like every day you get to go on a treasure hunt, and you're not quite sure how to get there, and you have to figure out the map, and there's bits missing, and you have to fill them in. But ultimately, what you're looking for are those kind of little nuggets of discovery, and when you find them, they're just wonderful. And when you can apply those, so it's the discovery and then the application of those, the satisfaction of having those discoveries then translate into something tangible that you can see and touch and potentially will go on to make a difference to a person. I mean, that's just it's a wonderful part of what we do. It's a massive privilege, it has to be said, to be able to do that for a living. I've tried to do other stuff, it just didn't work for me. I had to come back to it because that's a beautiful thing.
Thank you. I love that treasure map analogy too. I might steal that. Professor Kate Hoy and Dr. Clare Fedele, I want to thank both of you so much for sharing your thoughts, your experiences, and your wisdom. I'm going to give you a clap, and I'm sure other people would be clapping too if we were in person. We can't see you clapping, of course, but join me in thanking them both. And I think, you've taught us a lot. Like, it's never too late to learn things. Success looks different to everyone, and just find your path and find what matters to you. I think that's so, so important. So thank you both. And I think when thinking about diversity and inclusion in STEM and biomedicine, it begins with conversations like this and listening to people like you. And we all need to support each other, I think, especially as women. So thank you very much for being such inspirational speakers to us. Everyone who's on the call, I would like to invite you to the Convergent Science Network's event next Tuesday. If we've already convinced you that communication with the public is important, this event is for you. It's Beyond Vaccines, examining public trust in medical research. And that question of how biomedical research is perceived by the wider public has been very much front of mind lately, and it's not just because of the experiences of COVID-19. And that idea of whether the public trusts the work of biomedical sciences, it's a crucial issue. And that idea of communicating science with the public, perhaps not discussed enough. So Claire said that, we need a whole hour on this. Well, we have another whole event on this. So the Convergent Science Network has convened a panel of experts from diverse backgrounds to discuss these topics and ways to move forward. And the event will be held next Tuesday, the 21st of November, starting at 6 p.m. And you can attend in person at the Bio 21, or you can tune in online. And the event, like this one, is free. So come along. You can get more details from the CSN website. We hope to see you there. Thank you very much, everyone, for joining us on this Wednesday afternoon. You will receive an email this afternoon asking you to complete an anonymous survey. It just really helps us in terms of planning for future events and hearing your thoughts. But again, thank you, Claire. Thank you, Kate. We couldn't do this without you. We also couldn't do this without the sponsors. So join me in thanking Claire and Kate again, as well as our sponsors. Thank you very much, everyone, for joining, and I hope you have a lovely afternoon. Take care.